demonstrate the ability to create a concept map based on a clinical situation. A concept map are graphical tools for organizing and representing knowledge in a network of concepts and linking statements about a problem or a subject. Concept maps provide a visual format to express concepts and their relationships in a nonlinear structure. Keating, in 2011, defines this as a way to illustrate integration of concepts into cognitive understanding and related behaviors. Detailed analysis of concepts and their relationships are shown in a logical sequence. Nonlinear thinking, critical thinking skills are important in gaining a total perspective of a clinical situation, understanding of the client's needs, and helping the students to be able to synthesize and prioritize data. In healthcare, concept maps are used to help the learner to better understand the clinical presentation of the patient. Learners are encouraged to focus on the whole picture versus one specific intervention or symptom. The map starts with a word, a phrase, a case study, or an idea that captures the main concept. This is written in a box or a square and placed in the center of the page. Additional knowledge or thoughts that the learner has related to this concept are placed in boxes or circles that surround the main concept. These additional boxes or circles are known as nodes. Lines or arrows are drawn between the shapes to indicate relationships that exist among these concepts. As a learner progresses and new information is added, the quality in the nodes improves, as well as the ability to identify existing relationships. For today, we have chosen to do a concept map that is geared towards a novice learner. It's a simple concept that we've chosen to use pathophysiology of the disease process. The one we chose to use was an MI, myocardial infarction. We are going to start our map in the center, with the center being risk factors. Risk factors are things that lead to the development of an MI. In this case, some of the risk factors we've noted are modifiable risk factors such as high cholesterol or lipids, smoking, sedentary lifestyle, diabetes, hypertension, obesity, stress. Non-modifiable risk factors associated with this disease are age, gender, family history, and ethnic background. These risk factors lead us to point the arrow towards disease or the medical diagnosis. In this case, an MI, which is necrosis of a portion of the cardiac muscle caused by an obstruction in a coronary artery that results from atherosclerosis, a spasm, or a thrombus. A patient with an MI will experience these signs and symptoms. They may have sudden onset of chest pain. It may radiate to the jaw, to the back, to the arm, to the shoulder. They may have diaphoresis and shortness of breath. They may have nausea, vomiting, dyspnea. They may feel fear or anxious. They may be ashen in color, clammy. They may have dizziness. They may have dysarrhythmias or palpitations. They may have tachycardia, low blood pressure, or ST or Q wave elevation. These symptoms lead us to the pathophysiology of the disease process. This is what is going on in the body that causes these signs and symptoms. In an MI, we have atherosclerosis of the coronary artery. This leads to ruptured plaque, which leads to platelet clumping, which leads to a thrombus or a clot formation. That causes occlusion of the blood flow, which causes an infarction or necrosis. Ischemia, which is lack of oxygen or hypoxia, leading to vasodilatation or acidosis. This leads into electrolyte imbalances, which causes changes in the conduction and contractibility of the heart. This increases the heart's O2 requirements, which causes sometimes ventricular dysarrhythmias. may do when we're checking a patient for an MI, we would do an EKG, and they may or may not have an elevated ST wave. Their SED rate will be elevated. We may do an echo or a stress test. We will do cardiac enzymes, which include the serum CK, the MB, and the troponin. These may not initially be elevated, but we will watch them over time and they will elevate when an MI is present. From here, then we look over at the treatment for an MI. All patients come in with an MI usually get aspirin, morphine, oxygen, nitroglycerin, and then depending upon the physician, antiplatelets, beta blockers, ACE inhibitors, angioretention blockers, glycoprotein inhibitors. Sometimes we will give them IV thrombolytics to dissolve the clot. Sometimes they may have to go to the cath lab and get a PTCA, which is angioplasty and stent placement to the vessel that's occluded. And in some cases, we may even have to do CPR. So when we look at the whole map, you see how all of the concepts are all related. The risk factors leads to the diagnosis, which leads to these types of signs and symptoms. Now, you may not have all of these with your patient. You may only have some or sometimes none. Some people have silent MIs. If you want to make it more specific to your patient, you can underline the things in red that are related to your patient. Maybe they had diaphoresis and shortness of breath and shoulder pain. You can underline the specifics to make it more individualized. This tells us what the pathophysiology is of the disease and why it's causing these signs and symptoms. Which leads us over again to when we present with these types of symptoms and this type of pathology, then we're going to look at these type of diagnostic tests. So you can see how all of these risk factors are interrelated, and that's what we want you to learn. We want you to learn how this affects this, how this affects this, so on, etc. You can see they're all related. Okay? This is more geared towards a novice learner because this is a very simple, pretty straightforward map. However, you can use this type of learning strategy with different types of learners. It can be effective for all types of learners, and it encourages active involvement of the student. The concept map employs an active learning strategy that increases the analytical thinking process, the ability to problem solve, to clarify relationships, and to link old information with new information. This increases knowledge and understanding of clinical experiences as well as linking the theory to the clinical application. Students are forced to use critical thinking and clinical reasoning while using a minimal amount of writing. Ideas are documented through the map. The instructor can focus the mapping assignment to meet the course objectives by providing the major concepts such as the physiological or psychosocial needs to promote a holistic nursing perspective. In this case, we chose pathophysiology of the disease. Additionally, the instructor is able to assess the absorption of the concept being taught and readily assess the student's critical thinking ability related to the concept. Review of empirical studies of concept mapping indicates that this strategy improves students' critical thinking ability and academic performance. I hope this gives you a better understanding of concept maps. Are there any questions?